Hand, foot and mouth disease. A comprehensive guide to understand not only how to treat but also how to prevent this common childhood illness that can also affect adults. What is the hand and foot and mouth disease? Hand, foot and mouth disease is a common childhood illness that can also affect adults. It usually gets better on its own in 7 to 10 days without specific treatment. This condition is not the same as foot and mouth disease that affects farm animals. They are completely different illness. Early signs. First symptoms. The initial signs typically include a sore throat, high temperature, and loss of appetite. These symptoms appear before the characteristic rash develops. The second stage, a few days later, mouth ulcer and raised rash of a spot appear on hand, feet, and sometimes the groin area and bottom. Recognize the rash. The characteristic rash appear as spot that can look pink, red, or darker than surrounding skin, depending on the skin tone. These spots may develop into blisters that can be gray or lighter than surrounding skin. The rash typically affects the hand, feet, and sometimes extends to the groin area and bottom. Symptoms are usually mild and identical in both adults and children. Mouth ulcers are key symptoms. Mouth ulcers are one of the most distinctive and uncomfortable symptoms of hand, foot, and mouth disease. These painful sores can make eating and drinking difficult, particularly for young children. The ulcers typically appear on the tongue, inside the cheeks, and on the gums. They can vary in size and may cause significant discomfort when consuming food or beverages. Self-care treatment options. Hand, foot, and mouth disease usually resolves on its own within 7 to 10 days. Antibiotics and other medications cannot cure the visual infection, but several measures can help manage symptoms effectively. Hydration. Drink plenty of water. Cool fluids to soothe the mouth and prevent dehydration. Avoid acidic drinks like fruit juice, which can irritate mouth ulcers. Gentle foods. Eat soft foods like yogurt and avoid hot, salty, and spicy foods that may cause additional pain. Pain relief. Take paracetamol or ibuprofen to help ease sore throat and other throat symptoms. Pharmacy support available. Your local pharmacist can provide valuable advice about treatments to relieve pain and discomfort. They can recommend suitable mouth ulcer gel, sprays, and mouthwashes. Pharmacists are particularly knowledgeable about which treatments are appropriate and safe for children, ensuring you get the right advice for your family needs. When to see your GP. Non-urgent consultations. Contact your GP if symptoms don't improve after 7 to 10 days or if you are pregnant and develop the condition. Check before visiting. Always check with your GP surgery before attending, as they may suggest a phone consultation to prevent spreading the infection. Urgent medical condition. Urgent medical attention required. Seek urgent GP appointment or contact NHS 111 if you are or your child experiences concerning symptoms that may indicate complications. Very high temperature. If you or your child has a very high temperature or feels hot and shivery, worrying symptoms. If you are concerned about your child's hand, foot, and mouth disease symptoms. Dehydration signs. If your child is peeing less than usual, indicating possible dehydration. How the disease spread. Hand, foot, and mouth disease is highly contagious and easily passed between people. Understanding transmission helps prevent further spread within families and communities. Respiratory droplets. Spread through coughs and sneezes. Contaminated surfaces. Contact with infected surfaces, feces, and blister fluids. Reinfection possible. You can contract the disease multiple times. Contagious period timeline. Understanding when the disease is most contagious help in making informed decisions about isolation and returning to the normal activities. So before symptoms, it can spread infection a few days before symptoms appear. The second one is peak contagion. Most likely to spread to others in first 5 days after symptoms start. Recovery phase. In third one, contagiousness decreases as symptoms improve. Essential prevention measures. Simple hygiene practices can significantly reduce the risk of spreading hand, foot, and mouth disease to family members and the wider community. Hand hygiene. Wash hands frequently with soap and water, including children's hands, especially after using the toilet and before eating. Respiratory etiquette. Use tissues to trap germs when coughing or sneezing and dispose of used tissues immediately. Avoid sharing. Don't share towels, cups, cutlery, or other household items that may harbor the virus. Household hygiene protocols. Maintaining high standard of cleanliness in home environment is crucial for preventing the spread of infection to the other family members. Laundry management. Wash soiled bedding and clothing on hot wash to eliminate the virus effectively. Handle contaminated items carefully to avoid spreading infections. Surface cleaning. Regularly disinfect frequently touched surfaces, toys, and areas where the infected person spends time, particularly bathrooms and bedrooms. School and nursery guidelines. Understanding when children can return to educational settings helps balance health consideration with educational community. Stay home when unwell. Keep your child off school or nursery whilst they are feeling too unwell to participate in normal activities. Return when ready. Children can return as soon as they are feeling better. There's no need to wait for all blisters to heal completely. Extended absence unnecessary. Keeping children away longer than necessary is unlikely to prevent the illness from spreading further. Hand, foot, and mouth disease in pregnancy. Whilst hand, foot, and mouth disease usually poses no risk to the pregnancy or developing baby, pregnant women should take extra precautions to avoid exposure. The main concern arises if infection occurs shortly before giving birth, as this can result in the baby being born with a mild version of the condition. Pregnancy precautions and advice. Avoid close contact. It is best to avoid close contact with anyone who has hand, foot, and mouth disease during pregnancy as precautionary measures. Seek professional guidance. Speak to your GP or midwife if you have been in contact with someone who has the condition for personalized advice. Monitor for symptoms. Be aware of early symptoms and seek medical advice promptly if you develop sign of infection. Distinguishing from other conditions. If you are unsure whether your child has hand, foot, and mouth disease, it is important to consider other possible causes of rashes in babies and children. Many childhood conditions can cause similar symptoms, so proper identification helps ensure appropriate treatment and prevent unnecessary worry. Recovery timeline and expectations. Most cases of hand, foot, and mouth disease follow a predictable pattern of recovery, helping families plan and manage expectations during the illness. So, between day 1 and 3, initial symptoms such as fever, sore throat, loss of appetite, that's what you experience. And between day 3 and 5, rashes, mouth ulcers develop. Peak discomfort period. So, day 7 to 10, symptoms resume naturally, return to the normal activities.